Social Services. And now to our Honorable Governor for her opening remarks.
Thank you, Janella. Happy day. For the past few days, I have been cautiously optimistic about our fight against COVID-19. This virus has not only affected the health of our people, but the health of our economy. I want you to know that we are healthy and will continue to help people whose lives and businesses have shut down. Those who have been temporarily laid off or fired from their jobs, and those who are struggling to keep small businesses going. Through the CARES Act, the SBA Paycheck Protection Program provides loans to allow businesses to keep paying staff despite being shut down due to this pandemic. Under this first round of this program, 508 local businesses were approved for loans, totaling $102 million, the highest per capita among the territories. We are anticipating additional funding, and I encourage our local businesses to submit their applications. We are also waiting on federal action for the implementation of the Pandemic Unemployment Assistance and Federal Pandemic Unemployment Compensation. We have submitted all necessary documentation for these unemployment assistance programs, but we can only work as quickly as the federal government acts. This situation is not unique to Guam. No other territory has implemented these programs. But know that we are continuing to do what we can locally. Since the beginning of this pandemic, we have issued over 1,800 tax refunds for 2018, totaling $8 million. 2 weeks ago, I announced that my administration would issue advanced local stimulus checks for our most vulnerable population, and we did. Last week, 3,200 advanced local stimulus checks were sent, totaling nearly $5 million, and millions more in checks are being mailed now. For those who need additional help, Public Health continues to process and approve public assistance applications. Since April 1, we received 215 new applicants for SNAP, 110 new applicants for Cash Assistance Program, 48 new applicants for MIP, and 134 new applicants for Medicaid. We have paid nearly $100 million for these programs this month. Public Health is also continuing their Senior Meals Program. Since the start of April, they have delivered over 850 meals a week, totaling nearly 217,000, with plans to increase this by 300 more. These meals are delivered 5 days a week to arm and uncle. We also know that children are among the most vulnerable when it comes to access food. By tomorrow, GDOE will have served 500,000 meals to children in need. What began as a lunchtime service has expanded to include breakfast meals. This meal program costs $101,640,000 per day, a portion which is reimbursed by the federal government. Pending USDA approval, GDOE hopes to continue this program into the summer using the $1 million I transferred to them this week. Beating COVID-19 is not just about eliminating the virus, but it's about tackling its consequences. This is a difficult time for all of us, but we are not going through it alone. We are in this together. And together we will be able to overcome the fear and anxiety that we all feel. The people of Guam have always been resilient, and I know we will all come out of this stronger than before. I'd like to ask Linda now to give updates on her COVID
Yes, thank
numbers.
you. Thank you, Governor. As of yesterday, you all know through our dashboard that you go to Google and then you type in www.dphss.guam.gov. We give you all the information in regards to our updates that are being done daily. Yesterday, we had another positive case from the U.S. Naval Hospital, and as you know, this is testing that is being done directly through their Department of Defense reference laboratory in San Diego. And because of that, we're now up to 138 COVID positive cases. And the breakdown, as I remind you, 117 are local, 13 are from the U.S. Naval Hospital, 5 cases are confirmed by DLS, and 3 clinically diagnosed local cases, and thus we have 138. I also would like to just give you an update in regards to the travel history and the no travel history. Again, 18 with travel history, 120 with no travel history. The breakdown of that 120 are as follows. 33 are household contacts, 13 are community contacts, 19 are healthcare contacts, and that's further broken down to 5 as a patient, 14 cases as healthcare workers, and 55 have no reported contacts at all. In regards to our quarantine sites, just to give you an update, we still have 176 individuals that are in our local government of Guam quarantine areas. And the update as of today, April 23rd, and we had discharged 6 more from our quarantine in that regards that they have completed their 14-day quarantine. And so from the beginning of April 2nd all the way to April 23, we have right now 388 travelers that have completed the 14-day quarantine. We currently have in isolation 4 people. In regards to our recovery, 126 have recovered. I would like to take this opportunity now to just give you a heads up as far as what the Department of Public Health is doing and how we are collaborating in regards to this pilot project, the COVID-19 pilot project, which is a drive-through and a walk-through testing. As you know, we want to change our posture in the department through the elimination of the COVID. And in order to do that, again, we're doing 2 types of testing prong approach. The first is expanding our testing criteria to allow a lot of our patients that have mild cases now and mild illnesses to come forward, again, presenting themselves at the private clinics as they normally do. And also, we are doing what we call the second prong, which is active case finding. We're now going out and reaching. In this coming Saturday's specific COVID-19 pilot project, which is going to be held at the Stumbo Gym, we are targeting the residents, specifically of the Sagan Linahadzen and the Lower Astumbo Dedido. And as we speak, we already have our team of the surveillance, which is comprised of our nurses, as well as our containment team, out with the mayor of Dedido's staff, Mayor Savars' staff, together working in collaboration to begin the assessment to identify all those individuals that have symptoms of COVID and are experiencing those type of symptoms. We also are assessing those that have the symptoms if they have any other preconditioning medical conditions, and as well as if they have multi-generational home in their area. If they meet all these criterion, as I mentioned earlier, then our nurses will determine if they will be eligible and in support of being the one to be tested at the site, which is the Istanbul Gym. They will get a pass, and that pass will allow them to come in to the Istanbul Gym. And for that reason, it's not to say that we want to make sure that this is at an area, as I mentioned, just for the Sagan Linahadzen and the Lower Astumbo residents. And again, all these passes will be numbered and they will be provided based upon the assessment done by our staff at the Department of Public Health and Social Services. Thank you, Governor.
All right, thank you. We're open for questions now.
All right, we'll begin with TDN Steve Limsiaco.
Hey, thank you. I had a question about the Navy testing. So I noticed in the JIC releases, it doesn't really disclose how many tests the Navy has conducted of the local community. And I'm wondering, isn't that important to determine the positivity rate that was mentioned yesterday? So is that information being disclosed by the Navy?
The Navy is the residents that live on Guam and they are residing here. We do not include the information that's from the Theodore Roosevelt. What we're focusing on are the ones that have access to the Naval Hospital and the residents of Guam, and that's what is reported to the Department of Public Health.
But I'm talking about the total number of tests conducted I mean,
Yeah.
they're showing results, but it says not applicable when it
That's
says how.
already included in our numbers when we get the results. That's part of our tallying of information. Yes, as far as if you want the total that we've been testing, just altogether that we have in our laboratory, not to mention, we also have not only Naval Hospital, but also DLS that we're also sending labs to. And in our tabulation, we have 1,130 tests that have been performed. And that's inclusive of the ones that are rerun again, that we are, is the same person, but they're tested more than once.
Okay, and for my second question, Governor, do you still plan to open homeless shelters? And if so,
Yes.
when is it going to happen?
We actually were just discussing that this morning. The National Guard are doing the renovation of the bathrooms and the showers, and then our biggest barrier there, Steve, is that we wanted to get individual tents, and there are no individual tents for sale here in our own local resources, which means we have to buy them off island. So as a makeshifting, Public Works is going to open or erect tents and make sure that there's some privacy and sections cordoned off for the individual homeless. And the National Guard has said that it would probably take them about 5 days to do the renovation. So I'm looking at maybe late next week or early the following week.
Thank you, Steve. I-94, Adriana Cotero.
Hi, Governor and Linda. So we know FEMA and the Army Corps of Engineers were near the end of their site assessments for alternate care facilities. And last we had reported they narrowed it down between two sites. But do you have any update on those assessments? Can we still expect those to be up, or has that contract been suspended as well? Governor, you had previously mentioned you were pushing for medical tents that would include about 1,000 beds to be open closer. Can we get an update on that operation too?
So because of our actual numbers that we're seeing, and it is a slow spread, right now, if we are going to look at October, where we're predicting that the peak would be, it would be needing about 40 additional 40 spaces in terms of hospital beds. And so right now, our current inventory of beds and our current inventory of local resources without using the alternative care facilities will meet that capacity. But we did get the site assessments, and I think they're still doing some site assessments, Adriana. They're not totally finished, but now they've scaled it down, and it's not really converting hotel rooms into beds now, or sorry, hospital rooms. We're looking at using maybe just very simple renovating, and it's not even renovating, it's mainly just making sure there's oxygen in the room and so forth. So they scaled it down, which would mean that they wouldn't have to be able to have a lot of time to do the renovation. So they're saying, well, what we're thinking is putting it at the back burner for now. And if we continue on and we monitor and we're seeing much more increases in positives or increases in illness going to the hospital, we can activate that within 2 weeks. And so in the meantime, we are using the medical tents. We are buying blue mats, which are medical tents that we can have along with beds, and we are going to keep that also in our inventory.
Okay, so just to clarify real fast before I get to my next question, so has that contract been suspended with FEMA?
I don't know if it's suspended because we're still moving along with the assessment site. I don't think it's suspended. We still have the contract, and they're still there waiting for us to activate it.
Okay, All right, thank you. And then I know you just touched on this in your introduction and you mentioned that checks are being mailed out, but there is a message being circulated and I would like to get your response and reaction to it on behalf of the community. So I'm just gonna read it out loud. It's a little long, but I'll read it to you. So it says, "Dear Governor, while I live on the same island as you, I feel a world away. You asked us to help you, we did. You asked us to close our business, we did. You asked us to stay home, we did. You asked us to continue to stay at home, we are. So here I am at home waiting. You told us don't worry, unemployment will come, it hasn't. You told us don't worry, grants are coming, they haven't. You told us don't worry, forgivable loans are coming, they haven't. You told us don't worry, stimulus money is coming, it hasn't. So here I am at home waiting. I wait alongside most of my fellow small business owners, those self-employed and independent contractors, a massive number of Guamanian residents who are waiting for the unemployment portal to open for us, waiting for loan approvals, waiting for stimulus checks. All of these programs we are at the back of the line for. So here we wait while bills come daily, savings continuously dwindling or have been exhausted, and still doing our part. It is time you do yours. It is an inconceivable expectation to close unessential business, halting all income and expect us to survive. We need to pay our bills and put food on the table. Without immediate action, you are leaving us no options. How are we to survive? We deserve an answer. You owe us answers. Coming soon is no longer acceptable." So again, I ask you, what is your response and reaction to that, to the community?
So my reaction to that is that I am being responsible. First, the reason we closed non-essential businesses and non-essential government employees is to first and foremost protect the health of our people. First and foremost, to fight the virus. First and foremost, to make sure that our uncles will not be exposed and have to and have to be maybe one of the fatalities. That's what I'm trying to prevent from happening. So yes, my responsibility is to that first and foremost. Additionally, yes, the economy is also our whole responsibility. And I also wanted to say that loans, the PPE loans, are here already. Businesses have been approved to the tune of 102 million, which is about 508 businesses. Accordingly, so the Congress has recognized that it's been maxed out. So they are going to be providing more funding. So then again, that opportunity for our small business people will be there. We have given the loans out for the economic, I think it's called the Economic Injured Disaster Loan, which is the one from SBA that's about a 2 million, up to 2 million. That also has been approved and the loans have been given out to businesses. And I know this because businesses have gotten the loan. Additionally, I have not forgotten our people. Believe me, our people is the foremost of my mind, day in and day out, 24 hours a day, 365 days of the year. I am just as frustrated with the delays and with the lateness of the federal grants. And that is why I decided to use whatever I can within our local funds to advance the economic recovery program. So we actually have printed out 3,200 checks this last week and a half. There will be 3,200 more checks being printed out again for the next week and a half. Once those monies come in, we are prepared and ready to print checks for everybody. That's about the tune of $134 million. That one is going to be happening probably, like I said, first week of May or second week of May. The pandemic unemployment benefit programs, we have worked out all our processes from our end. We are just waiting for the federal government then to approve our application process, to approve our processes, and to approve the plan that we are putting in. I don't have control over the federal. What I do have control over is our local funds and our local programs. Our public assistance, like I said, has been increased 64% since the beginning of this crisis. We have put out about $100 million in public assistance. That includes the food opportunities, food accessibility. That includes cash assistance. I have increased the eligibility of our people to be able to get Medicaid by increasing the poverty level up to 133%, which means more people now can be eligible for health care. Additionally, we have continued the senior centers, the senior member arm and uncle meals every day. We have added to that. And also the Department of Education's food nutrition, we have also added to that. And now they're giving our children, our very vulnerable, precious children, 2 meals a day. And so I really understand and empathize with this writer's concern. And that's why I am working as quickly and as aggressively as I can, given what I can afford locally here, given what I can do to pressure so we can expedite the approvals that's needed. We just got the guidance for the unemployment plan. We haven't even gotten the guidance, sorry. The other guidance is for the the coronavirus stimulus package. But I want to assure the public that, I am not sitting and not doing anything for our people. I'm working very hard with what our local programs are. I'm working very hard with whatever local monies I can. We have also are expediting our tax refunds out there. So to say that, I'm not doing anything, I don't think it's a fair characterization of what this administration has been doing.
Thank you, Adriana. Next is Guam Daily Post, John O'Connor.
Can you hear me?
Yes.
Thank you, Governor. So to kind of go off on that point then, this Bill 340, which was supposed to assist some certain individuals using local funding, that was set aside. But if that bill does make it back to session floor somehow, will you support that measure?
I don't know what Bill 340 is. John, can
Bill
you
340 is the bill from Senator Regine Lee. This would have used local funding to provide $400 for single tax filers and $800 for eligible joint filers. And this was sort of like a local version of the federal stimulus that we're getting. And this was talked about during session. So.
Right. So that bill actually, and I do appreciate Senator Regine Lee's, also compassion to pass legislation that would help our people. But it's actually now more than 300 or 400. It's now 1,200 and 2,400. So I believe that's why the bill was set aside, because the federal stimulus was already approved. And I think at the time, I don't know if the president had already signed the CARES Act, but once the president signed the CARES Act and it then gave the recovery stimulus packet program, then I think that may be the reason it was set aside. But we're certainly working very closely with Senator Regine Lee, as she's the head of the labor, and she's been working with us over this pandemic unemployment benefits package, and she's helping us in any way that she can to help with the processing and so forth.
Thank you, Governor. So for the second question, I am looking back at Dr. Cabrera's slides from yesterday, and I don't see him here today, but I'm hoping someone can answer this question. So in one of the slides, it shows the current trajectory we're going at, or the projections for if we don't, if we keep the mitigation efforts current. It does say that we have significantly flattened the curve with our current efforts, but we are also looking at some peaks later on in the year, maybe August or September. What factors will lead into that peak? Because it doesn't seem to make sense that if our current efforts are flattening the curve, why would they lead to a peak later on? And maybe it ties into this other part of the question, but there's a lot of people who believe that we just don't have the data to say that we have flattened the curve because we are just beginning our expanded testing. So maybe you can provide some more insight on the projections here.
Yes. So the one where you're looking at, where there's like a surge over in the, and this, by the way, is just hospital census projections. These are what could happen with the hospital cases if we did not, if their current mitigation is unchanged for the next 6 months, I guess, that he's looking at. And so if we continue on with the same things that we are doing and nothing is changed in the next 6 months, this is what they're projecting will happen. However, if you look at the next one where he's talking best practice ramp up, like testing of capacity to be increased, and also again a more robust and aggressive public health strengthening of the positive isolations and the contact training, or sorry, contact tracking, tracing techniques, then we can continue on with our slow trajectory. I mean, our slow community spread to where it will not impact the hospital being overwhelmed with the with patients and the illnesses that will be coming in. Yeah. So the answer to your concern is that we will strengthen our mitigation efforts, and we will strengthen and expand our capacity for testing. And as we go along, we will be monitoring the data that we will be seeing, and then again we can start talking about recovery and moving forward with lifting some of the restrictions. But once that's been lifted, we will also be very, very strong in our contact tracing and also in our testing.
Right, and in line with that too, the emphasis we want to make is the increasing the ability to test more. And that's why we're looking into what we're doing right now with our pilot project, so that we continue to identify pockets of infection of these individuals that may not be able to come forward with mild cases of illnesses. And the more we have the ability to test, the better off that we are able to have a clearer picture. The more data, the more ability for us to look at the incidence and prevalence of our entire community as far as going towards elimination to flatten the curve. And as we mentioned earlier, we want to do that. And we want to start with these COVID patients that stayed at home, didn't have the ability to go forward to going to the hospitals or even the private clinics or even the public health clinics. So what we're doing is we're doing case findings. We're identifying these in our community. And again, this is a first that we're doing in the Adelup gym as a first takeoff in our pilot project. That's not to say that we don't do this every time. We do this on a monthly basis of going out to the community. That's been a thing that we call community outreach, extension of our community outreach efforts. And the more we have that ability to get the data to test more, and the more we identify there are positive cases, then we want to continue on to prevent the further transmission of the infection. And again, that's through household contacts or contacts that people come in close contact with the individual that is COVID positive. And eventually we keep continuing these efforts to the point where we can say we completely eliminated it. We want to also move it further up so that we can also test not only these areas where there are high-risk individuals and vulnerable populations, but also go forward and prepare for the next level, which is to test our healthcare workers and all these other individuals in our community. And then from there, the governor has already indicated that she is going to move forward and then start eliminating some of these restrictions that she's had to continue to contain the infection in our community. It's called the area of recovery. Governor, would you like to elaborate more about it?
I just wanted to say, John, that the extended capacity of the contact tracing is very crucial and very critical, because that's how we can, like Linda said, that's how we can contain our slow growth, our slow spread, and that's how we can, be able to contain it and even eliminate the virus. And what that is, I want the people to be very clear, is that with contact tracing and with testing, we can identify people who are positive. And then we take the source of the spread out of the environment. Either we make sure that they home isolate with the CDC guidelines of home isolation, with monitoring regularly with these individuals, or if that environmental condition is not met, we will take that individual out of the environment and put them in a government isolation. That way, you are now eliminating the source of contact and transmission in that community area. So we continue doing that, and that's how we can, again, continue flattening the curve and continue containing a slow spread and goal of eliminating the virus.
And as you journey through the days, it's not that we're going to stop completely. We want to continue this. We want to enhance our ability to do quarantine and isolation enhancement. That is key. We want to have this permanently within our department so that we can also move forward in taking the programs that we've halted because of this infection of COVID-19, such as our TB programs and our STD HIV programs, and continue to have them back into our routine. So we're going back and looking at all this, plus continuing all the efforts to isolate and to quarantine. And as we journey through, we will be prepared so that the second wave, if we ever do get it, we're going to be prepared. And again, we won't have as many people going to the emergency room for COVID cases, and then be in the situation that we're going backwards instead of going forward.
Thank you, John. Next is K57, Patty Arroyo.
Good afternoon, Linda. Good afternoon, Governor. Good afternoon. The emphasis has been that this is a pilot program, and the sampling of Saga and Lina. Are you there? I'm sorry.
Yeah,
Yes.
we're here.
Okay. In the sampling on Saturday, positive or negative, how would this influence more testing? I know you partially answered that question, but
Yes.
there's a timeline for these results to come back, to move to the next level. And it sounds like it's a long timeline. How soon will these results come back to where you can decide whether or not more testing is necessary for other of the higher impacted communities?
Well, we'll start off with what we have right now. We're planning to continue the momentum as we speak. And of course, we are going to not only look at one area, but the different regions throughout the island. So in terms of the time frame, we know that May is where our executive order comes to an end. So we're taking this opportunity to start doing the work as far as identifying other pockets of infection in the other areas and other regions of the island. So again, our ability to continue the testing and our ability to get a lot more test kits in, we will do everything we can as far as continuing the momentum to go into these areas. The sooner that we get everything in place and the sooner that we get more and more test kits, the sooner that we continue our work. And again, we are going to move forward. As far as a timeline, I know you asked me that this morning on the station. Again, I don't have a definite timeline. It would all depend upon what type of data we collect. And of course, if we see more positives, then we are going to, again, identify all those household contacts and other community contacts. And the key here is delaying the further transmission within our community, which we've done because of all the social distancing and making certain that those that are arriving, that we quarantine them, we isolate them, whether we do it at home or in an isolation facility within the government. I don't have a time frame that I can tell you, but I can tell you that the more test kits we get, the better ability that we are to continue forward. And again, we are bounded by these test kits to be coming in from U.S. CDC and also from the World Health Organization that is going to be giving those to us because they are FDA or they EUA, emergency use authorization. And we are bounded through our department to follow the Clinical Laboratory Improvement Amendment Act. And so we have to meet those standards. And that's why we follow US CDC standards. So again, as we journey through, the more we have this ability to do that, then we can get a better picture. So I don't have a timeline, Governor, of when we can say this thing is going to come to a fruition where we're going to be able to say, we can go to recovery phase or really.
There are triggers, I mentioned these, there are triggers that would allow us them to go or give us more confidence to be able to be okay to go to recovery phase. And the triggers that we talked about is hospital capacity, the testing capacity, and 14 days of from the last positive, and also the slowing of the community spread. So Patty, I'm just
Thank you, Governor.
I'm just thinking, I'd like to see 2 weeks of data with this expanded testing and then look at where we would be at that time, and then I can review that with our recovery panel advisors and go from there in terms of phases. Yeah, and other governors are doing the same thing also.
Thank you, Governor. Thank you, Linda. My second question really has to do with the information that was released yesterday by JIC about the illegal products that be sold on the market. I today bought some items from the back of somebody's trunk, like a drug deal. And I wonder, because there is a sense of desperation for cleaning products, hand sanitizers and the like in the stores, how does public health ensure that there are no illegal products being sold? A lot of these products come with, and we already have a law in place that nothing is to be sold on Guam that is not at least partially written in English. And people are desperate and they're buying either substandard products. How do we ensure with the limited services of the public health department that these are getting out of the hands of people who are desperate to buy something?
Right. Anything that is coming in through our island, we have to have it reviewed through customs and quarantine. And what happens is we have a system that we collaborate very well with the customs and quarantine, that at any time, if they feel that any product is, may be mislabeled or they can't read it because there's no English written on it, they will call our department. And we have the Department of Environmental Health within our whole department that will do the inspection of these products, and they will launch an investigation. And if we need further information or assistance, we also collaborate with EPA, Environmental Protection Agency. If we need anything specific in terms of cleaning products and if they're safe, as you know, when we had the other outbreak with the dengue, with all the different products that are out there for spray, for the repellents, same concept. We're going to have to examine them and make sure that they're safe, and that's the key. And we involve our efforts with EPA and, of course, our department. If we need further assistance, I am a commissioner also of the FDA, and so is Tom Nadu and Rosanna and her team. So if we need other consumable products that are approved, we can contact them directly. And we have their phone number. And we can also send pictures of any items that we do see that there's a need for further inspection. And we can send those off island by taking pictures, and then we can get that information from the FDA directly.
Thank you, Patty. Next is appoint Nick Delgado.
Hi, Linda. Hi, Governor.
Hi, Nick.
Today. So I want to revisit the test kits out of South Korea. I know you said that it was a dead issue last week, but emails I have been circulating that show that GovGuam is now interested in or has started ordering 60,000 test kits from a South Korea supplier that doesn't have full FDA approval, but does have the emergency authorization from the FDA. So with that being said, have you changed your mind? And if so, how much is the cost that we're looking at and so forth?
Okay, so can I just clarify what I said about the debt issue, Nick? Because that seems to be the buzzword out there.
Yeah,
So
Governor.
when I said that, I said it with a qualification, and that is that if there are any of these products that are FDA approved or EUA approved, that I am willing to look at it. I went back and read those articles, and it was printed that I did say the Sogen product was a debt issue because it's not FDA approved. However, I qualified my statement by saying that if it gets into the FDA approved listing or the EUA, then we would consider it. Now, there's several things that have to be thought about here. So this product that we are looking at is the same product that Governor Larry Hogan, a friend of mine, had purchased from South Korea. And that one is EUA approved, I think. But the direction there was to research it and to come back to us, to me, and to make recommendations about the quality and so forth of this test kit. Now, my other research that I wanted to be found out is that this test kit require a separate kind of machine. Does this test kit also can be used with our current machines? Because most test kits have its own platform and have its own machine that will work with the test kit. So these are some of the researches that I am asking my people to do so we can have better information as to what we're going to do. And if we're going to do it, I want it to be done quickly and expeditiously. So we're at the stage now of researching. And I have always said that I am not adverse to any options. I just want to make sure, Nick, that our public is safe and that there is the security there and that there is the quality there and that there is the reliability of test results, because if they're not reliable, it could mean further endangerment of our public. For example, false negatives. If somebody did a test kit on somebody that we have no reliance on, it's not FDA approved or it hasn't been vetted through FDA, and it really is a false negative, that person's going to think they don't have COVID, and when maybe in fact they do. And so they're out there in the community transmitting the COVID virus. So these are some of the factors that I have to make sure that they are vetted.
Right. And I just want to add that there is a link, a website that you can go into and see if they are approved. Everything keeps changing. What we say now may be different tomorrow. And that's the reason why we just say, this is the link, we can search it, we can find information, because EUA is an emergency use authorization. And again, it changes as time passes. And so just want you to be kept in mind that what we say now will be different.
Okay, so we're still in that researching phase in regards to those specific test kits.
Yes.
Yeah. And all right, and so Can you also say about those emails that were sent out? I guess it looks like the one I received was from the speaker's office in regards to these specific test kits that was sent to the governor's office, and Dr. Mike Cruz were wondering why those specific emails were not disclosed as well.
You know, Nick, I'm sorry, I've been busy all morning. I haven't even gone through my emails. Usually I go through my emails late at night, the same as Linda.
Yeah.
So I'll have to look at the emails and respond based on what I read.
What we could do is I can send you, I did a memo out to the Customs and Quarantine. I can send you the exact same memo that has a listing of the link, and you can look it up, or if at any reason, that's an information that we do provide. Again, we go to CDC for guidance as well. And so if I have anything in question, I always resort to US CDC for guidance, because they're the ones that issue all the diagnostic technologies that we are aware of what is FDA approved and what is EUA, emergency use authorization.
Thank you, Nick. POC, Kevin Kerrigan.
I'm sorry that nobody from the Physicians Advisory Team is there, but perhaps I could address this question to Linda DeNorsi. We've apparently had our first wave, which included, what now, 138 positive cases, 5 deaths. Assuming a responsible and controlled lifting of restrictions in the weeks ahead, when the second wave hits in September or October, what does that look like? What can the community expect when that second wave arrives?
Yeah. We're going to refer to the guidance that we got, because this is a model that was used by Dr. Cabrera. So I believe it was on that.
We're trying to find the model here. My recollection is that the second wave is in October, and based on his second wave here, it's gonna look like we are going to be, I think, let's see. Yeah, we will be just about, the hospitalized census would be just about above the hospital threshold. The ICU census looks like it's also above the hospital threshold. However, the ventilators looks like we are going to be okay. And again, these numbers, Kevin, are just numbers of hospitalization. It's really not numbers of infected people.
Yeah.
Because that's the concern.
Right.
The concern there is, what is our hospital capacity, and can we provide the acute treatment for our people so that we prevent fatality?
But my question though is that people are concerned whether or not it's going to be worse than the first wave, which
Oh,
apparently
you know,
better.
just from talking to people and reading articles, and even reading like the Spanish flu that happened in 1918, that of course the second wave was worse. The first wave killed about 4.5 million people, and then the second wave I think killed about 15 million people. So based on that, you know, people are predicting that it would be also a very serious, very critical wave. And so our goal again on our strategies and our work as a community is to prevent the second wave from happening. Yeah. And hopefully down the road there'll be vaccinations and vaccines available, so then we can really have a really good immunity for the COVID virus 19.
But Dr. Cabrera yesterday indicated that it would be a more mild second wave. Are you saying now that you expect it to be worse?
You know, I don't remember what Dr. Cabrera said. Did you say more mild than the first wave?
Yeah.
Oh,
So it's going to be dependent upon how well we continue what we're doing right now, our efforts to contain the virus from spreading, and of course doing more testing and identifying all these pockets of infection that may still be out there, and doing everything we can to prevent the further spread. So usually if we continue to have, for example, off-island people coming here and we're still not being vigilant about quarantining them and just letting them in, then they can reintroduce the infection again, and then there you go, you have a second wave. So that's what we're very careful about. We don't even know if Philippines is containing their infection. I know there's over 6,000 cases that they have right now and hundreds of deaths. And so if we start getting them back into our community, and not everyone is fully immunized at this point, because there's only certain people that are immunized at this point are the ones that actually develop antibodies and got the infection, then that would be a reintroduction of the virus again into our community. And that's where, you know, we may have a problem if we lax everything out and we don't continue our isolation, we don't continue our quarantine. We have to enhance it. We have to enhance quarantine, enhance isolation, and let that continue like on a permanent level, so that we can continue when maybe October comes down the line that we're anticipating the second wave, that we're ready for it.
So I'm looking at the slide here, Kevin, and he has a slide here where he compares with the worst case, fully unmitigated, which the surge should be happening like in May 3rd, May 8th, May 13th. But because of our very aggressive measures and our early measures and our help with our community and our support of the community, we're predicting that it would continue in more of the flat curve, flattening of the curve. And then he has here in October, 5th, 10, and 15, 20, and so forth, is a slight increase in the hospital census, ICU census, but still way below the hospital threshold. So we can absorb and address those surges a lot better. But he does say that this is, if we continue on with our mitigation and our measures, then even enhance our measures.
Right.
Thank you, Kevin. Next is Mario's Business Journal, Wayne Chargaloff.
Hello. I'd like to just follow up on the testing kits from South Korea, the ones that are being researched right now. According to the letter from the Speaker's office, they're looking at there's a possibility to order between 60,000 and 200,000 test kits. And so it's conceivable that there would be enough test kits for pretty much everyone on island. How would that affect efforts to flatten the curve and the quarantine timeline? Is that a scenario that has been explored? And what would that look like?
So the whole concept here is increase in testing. And so if we get to 60,000, of course, we're going to increase our testing. And what it's going to do is it's going to continuously tell us more data. And so we can go in there and mitigate and do contact tracing and so forth. So I guess the thinking here should be that the more we test, the better. That would be the impact. And so either we can test it with to enhance our current testing supply. And if we do that, that's even better. So, just again to say, when whatever capacity we can to increase the testing, we will do that. And it would give us more information. It will make us a lot more knowledgeable about the community spread.
Okay, and going back to the sailor who tested positive, aside from the Theodore Roosevelt crew, when we're looking at military personnel testing positive, to what extent does that affect the quarantine schedule for the rest of the island? Are military personnel sufficiently isolated that they don't have a huge impact on that, or or what is their effect on our timeline?
So the military personnel are very sufficiently isolated, and they are on security guard for 24 hours a day. They are also medically assessed twice a day. And so it doesn't really have any impact in our community because they don't have contact with our civilian community. And they're very compliant and very adherent to the CDC infection control policies that we have agreed upon.
And once they test positive, they go back.
Yeah,
to
so
their-
if they're out in the hotel,
Yeah,
and
they go
all,
back.
just also for clarity and reinforcement, all positive individuals, sailors from the military are housed inside the fence. So the only ones that are outside the fence at the hotels are your negative sailors, negative results sailors. And by the way, they also retest them again.
Thank you. Can I get one more question?
Sure.
Oh, no.
Okay.
No, he's done.
No, no.
I'm not the keeper of the questions, so sorry.
Sorry,
That's okay.
Wayne. Thank you, Wayne. Nestor, are you there, Nestor? Stand by, Nestor.
Can you give me one question for technical difficulties?
Okay, go ahead, Nestor.
Okay, good afternoon, Governor. Good afternoon, Linda.
Hi, Nestor.
I know you touched on this earlier, but I'm see if I can ask this more directly. Would you support the use of additional local funds to provide immediate assistance to those families, say that don't qualify for SNAP or are not among the low-income families of 10,000 who make $10,000 or less? Be that in the form of an advanced stimulus like those low-income families, or an advance unemployment payments? And why or why not?
So my answer to that is, if we have the local funds to do it, I would certainly do it. In fact, I am looking at what we can do for those adjusted gross income individuals of 15,000. So, I am searching everything I can, Nestor, to help our people till the federal monies come in. And again, if I do have the local funds, I would certainly use those.
Okay, so, but do we have the local funds there?
Right now, we're really very, no, we don't have the local funds. I've used whatever local funds I have that I can for the advanced stimulus, for the 10,000 and below. Once we start getting the federal money, Nestor, we will distribute those monies out as fast as we can. We can also, and again, those individuals should also go to public health and cash assistance.
Yeah.
So, and we did raise the eligibility criteria. So I know who you're talking about. You're probably talking the low middle income population that have enough to not be eligible, but don't have enough to provide for their family.
And then they're also, if they need health, anything regarding health, they can also resort to the CAMIA centers. We do have a sign discount program for them if they need medical assistance. And we also have a payment plan so that if they're unable to get care, they can sign a payment agreement and still be served. We don't turn anyone regardless of their ability to pay. So that's another outlet for them to seek care. And I'm happy to report that, as the governor was mentioning earlier, we just received $2 more million for our manuncles, that criteria. And I've already instructed staff to begin the paperwork so that we can have enough to continue to feed them. And there are CARE Act grants that the department has been successful in getting them as well for the health centers and other programs within the Department of Public Health.
Thank you, Nestor. And now, closing remarks from our governor.
Sure. I thought Mr. had one more question.
I think that was his follow-up question. That second one.
Sorry. In this time of uncertainty, the spirit of our island culture has shined. Many have stepped forward to help their neighbors who are experiencing added hardship due to the pandemic. Knowing that many people have suffered a loss of jobs or hours and farmers have experienced a loss of income, Guahan Sustainable Culture raised funds to purchase produce from local farmers and in turn donating their produce to organizations feeding families and families themselves who are in need of food. Since April 10th, they raised over 2,200 and donated over 500 pounds of produce. Tomorrow, in partnership with the Barrigada Mayor's Office, they are continuing the effort by distributing free produce for Barrigada residents. They will have a drive-through at 5 p.m. at the old Barrigada Library while supplies last. Guahan Sustainable Culture plans to distribute more than 50 bags of produce, but is hoping to increase that number to 100. No one should have to choose between the health of our community and providing food for their family. Thank you, Guahan Sustainable Culture, for being a COVID hero. Thank you, and Sejus Masi.
Thank you, Governor. Thank you, everybody. See you again tomorrow. Please stay safe.